Few things reveal how power operates more clearly than the human body. The decisions societies make about whose lives matter, whose suffering is recognized, and whose access to care is considered a priority tell us a great deal about the world we have built and the values that underpin it. My guest today is Amanita Calderon-Cifuentes, a molecular biologist, HIV advocate and trans activist whose work sits at the intersection of science, identity, and social justice. Born in Colombia and now based in Berlin, Amanita has spent years challenging the idea that health, medicine, and research exist outside politics while navigating those realities herself as a trans woman and a person living with HIV. Today, we're talking about bodies, power, colonialism, public health, and the emotional cost of living at the intersection of all four. Amanita, thank you so much for being here.
Thank you so much, Davide, for inviting me. I'm very excited about this session and this conversation that we'll be having today. Let's start.
For those discovering you for the very first time, who is Amanita Calderon-Cifuentes?
Well, that's a really wide question, but let's just start by introducing the different parts of my identity that are important to me, right? So as you very well said, I am a Colombian. That is a huge, huge part of me. I have been working on HIV advocacy, completely dedicated to that for the last 4 to 5 years. But originally, let's just say that my dream was to become a scientist and to study the relationships that existed between organisms and microorganisms, which is why I became a microbiologist. And I had a long academic career of about 10 years until I decided to move towards the private sector and eventually the NGO world. I am working today very much from the intersections of my academic experience as a molecular biologist, but also from my lived experiences as a migrant, as a woman of color, as a transgender woman of color, as an indigenous woman, or like an indigenous ascendant woman. And yes, a lot of the work that I do, it's very much surrounding bodies and surrounding the way that we exert our freedoms to create and to shape our bodies and our identities, and how these impacts the health outcomes, especially of our communities, in communities where I live quite in the intersection, right? Migration, sex work, drug use, gender identity, queerness, HIV status, et cetera, et cetera. That's the general picture of who I am. The short answer to your question is I'm a witch. We'll take it from there.
We'll take that. But to unpack a little bit more the concept of witchcraft, you've mentioned living across and within several different geographies, but also communities. How would you say that living at those intersections has shaped your understanding of identity and belonging?
Well, okay. Let me just start by saying that the lived experience of a person, it's constantly determined by the number of little boxes that you click, right? All of these socio-demographic characteristics that will determine whether you have access to privileges or you will be facing obstacles. All of those different boxes, they will determine in many, many ways the experiences that you're going to have, the way that people is going to interact with you, the way that the system is going to respond to your needs. And because of that reason, the different intersections will make a huge difference, whether, you have the possibility to develop a career or not, or whether you have to engage with different type of other activities, whether it is transactional sex, or whether it is migrating from your house, et cetera, et cetera. For many trans feminine people of color, it's a very similar story. And I mean, of course, I don't want to generalize, but it is a trend that we see and among the different trans populations, and is that because of the fact that we are misunderstood and that our gender identity just simply constantly challenge the cis norm and the hetero norm, and in general, or the gender norms and patriarchy on its own. We are often exposed to such high levels of violence, discrimination, and harassment that we are constantly excluded from education spaces, from the work or the employment sector, from healthcare settings. And quite often, many of us find ourselves, especially those of us that live in the global south, we find ourselves in the need to migrate and leave our countries in the search and in the hope of finding better opportunities and better treatment in parts of the world that historically have presented themselves as more trans-friendly or queer-friendly. In that sense, I left Colombia precisely because I was running away from a system that was drastically conservative, highly impacted by the Catholicism inherited by our colonial legacy, which Spain left behind in Colombia, right? I left also running away from a conflict, from this very, very powerful social conflict that was happening in Colombia at the time. And I left with a dream that I could develop not just my gender identity and explore all the vastness of my gender identity, but also with the dream of becoming a scientist. What I realized was that regardless of the fact that I had certain accesses to privileges in Colombia, mostly related to class, I would still, or like my lived experiences and my outcomes would at the end be determined precisely by my other intersections. So because of all of this, I ended up in situations of precarity, economical precarity, that led to me choosing to do sex work, which actually I'm extremely grateful for the possibility that that happened in the moment. But it also cost, like it came with a cost, right? It came with a price. Down the same line, the engagement with certain drugs, because of this being a way of coping with a lot of distress, with a lot of minority stress, with a lot of depression and anxiety, but also because my own way of thinking and my own approach about life meant to explore intimacy in many different ways. So using drugs was also just something that kind of almost organically came into my life and have had really negative but really positive impacts in my life and have shaped a lot the person that I am today. Today, Amanita Calderon-Cifuentes is the outcome of all of that. And the way that I like to summarize this is that I am the love that I give to myself, the love that I give to others, and the love that I get in return. When you put it into context, that love, it's quite often shaped or decided by whether you are trans or cis, by whether you're straight or not, whether you are Black, white, Latina, etc., and whether you're a migrant or you're not a migrant, or in this case also whether you're HIV positive or not. And what I have come to realize is that the less access we have to that type of love, whether it is self-love or the love of our peers, the harder our experience in life will be. So I'm a very lucky girl because regardless of the fact that I have faced a lot of oppression, I am surrounded by so much love, and that has allowed me to be in the place where I am today. But because of the same reason, I feel this very powerful moral imperative to take on the privileges that life has offered me and not just overcome my own obstacles, but help the rest of my communities to overcome those obstacles.
Before we get to how you help the rest of your community overcome those obstacles, I want to touch on something that you have talked about when you mentioned sex work and drug use as having had a positive impact as well as a not so positive on your overall experience. I think I know where you're going with that. Can you elaborate for those that might not? I don't want to make assumptions. What do you mean? It might sound strange for some people to think that experiences with sex work or drug use have had a positive impact. What do you mean by that?
Okay, so let's start with sex work. For communities that have been historically pushed into poverty, such as trans women of color or people of color in general, migrants have been pushed into, having the possibility to find resources in a way that is, in a way that the systems does not allow us to find resources, so like having access to some resources, to an income that will allow us to eat, that will allow us to have housing. I mean, that is life-changing. It's an opportunity. If a system that is highly xenophobic will not allow me to work because of my migration status, and if that same system is stopping me from accessing education or accessing the work or the employment sector, then my last resource will be for example, sex work. And in my case, it was something quite very much down that line. The part that was especially important to me when I started engaging with sex work was that I was surrounded by a wonderful group of other trans sex workers that gave me so much cares outside of the actual sex work, like outside of like when I was actually doing sex work. But these people guided me on how to take measurements that would protect me from clients that could potentially be violent to me physically, emotionally, or psychologically. They provided a lot of accompaniment and just like very important conversations that were needed to have. And during those conversations, I got to understand that it's just for many of us, it's the last resource that we have. But for many of us, it's also a choice. And we definitely need to stop satanizing sex work, because most of the people who have an issue with sex work are people who have never engaged with it and are people that don't even start to grasp the realities of sex workers. Now, when it comes to drug use and to the community of people who use drugs, to me, it's just been very simple. I have never been able to understand the way that most people do things. When it came to engaging with the very big amalgam of drugs that exist, I was incredibly curious because as a scientist, I had informed myself on the impact that many of these drugs had in your life. When you're taking psychedelics, for example, we know at this point that psychedelics, especially psilocybin from mushrooms, it induces neurogenesis and it helps you loosen up the different synaptic connections that have been accumulated by trauma through history, and that will just gives you the possibility to have higher neuroplasticity for you to heal and deal with a lot of pain. The same way that using drugs can lead in a different direction when it's a different drug. At this point, my realization was, look, just like sex work, we've been engaging with drugs since before or from the very beginning of civilization. And it's not going to change just because a bunch of white cisgender heterosexual old men are telling us to stop. Because, well, this is almost as much part of our humanity as culture is. So when it comes to specifically drug use, to me, the approach was like, well, we might as well inform ourselves as much as possible on what are these drugs going to do to my body, and how, if I choose to engage with these drugs, how can I do it in a way that it's going to reduce harm to its maximum and maybe even have a positive impact in me. Again, all of these lived experiences that I had doing sex work and using drugs, and then meeting communities of people who engage with sex work and people who use drugs, they were not exempt of, or they were not detached from my identity as a trans woman, because you can be a trans woman who does sex work, who uses drugs, who is also a lesbian. And, like that's kind of the point. We live, all of us, we live in these different intersections to one degree or another. And these communities are quite present everywhere. And we interact in a way that the power dynamics will determine the outcomes of those interactions. So, to give you a little example, you and I will most likely run at this point into a party. Like, we're going to run into each other in a party. We're going to be sharing very similar spaces. And there is a higher chance for the two of us to do that simply because there's a few intersections in matters of queerness that will allow that to happen. Those are the spaces where we need to start looking and paying attention so we can figure out what is the best possible policies, laws, and practices that would benefit these communities and that will be taking care of these communities.
That's a very good point. Sorry, just very quickly on the drugs thing. When you talk about drugs in general, do you mean psychedelics mostly, or do you mean chemsex?
No, when I'm talking about recreational drug use, I'm talking about all type of drug use, right? Like I'm not specifically talking about one type. If you want to talk about chemsex, that's well, I mean, it's part of the conversation. And the conversation with chemsex, okay, from my own personal experience, which again, it's very different from the experience of a lot of people. So I don't want to generalize and say that this is everybody's experience. But to me, what happened when I started engaging with chemsex, especially with the use of crystal meth and GHB and Viagra during, like, sometimes when I was doing sex work, sometimes just simply in interactions with sexual partners, with hookups. One of the main things that became clear to me in that moment was that in engaging with cisgender heterosexual men that were attracted to trans women meant also engaging with their shame and their disgust, not just for us, but for themselves. Because unfortunately, we live in a world where if a cisgender heterosexual man is attracted to a doll like me, then they're automatically treated or perceived as a gay man, which for them is a horrible thing, right? And the thing is that in the space where I was, there was one way to obliterate that disgust and that shame, and that was through drugs, right? Once you take certain amount of drugs and certain type of uppers, especially, you lose inhibitions, you shut down your prefrontal cortex, and you just don't care so much anymore. And so you can engage in forms of intimacy that otherwise you would not allow yourself. When you think about it, it's so tragic that men and their sexual partners, including us, are pushed into doing like, let's just say, depending on anything other than the interaction itself, just in order for us to be able to engage with that type of intimacy. So when I think about it, and when I come back to that, I just keep thinking like, oh my God, a lot of people would not be engaging in problematic drug use if they didn't feel so incredibly ashamed about who they are. And that is actually the exact same reason why transness becomes such an issue for society. We are a constant reminder of that wound that everybody's carrying, cisgender people and heterosexual people included. So, yeah, using crystal meth at some point of my life, it saved my life. Using crystal meth at some point saved my life. Now, it also caused me a lot of distress and a lot of hurt. But today, it's no longer the case. And I'm just simply thinking that for the communities that are choosing to engage with chemsex, there are so many different ways to approach that, where you can reduce the harm to a maximum, and maybe you can start not like maybe you can start addressing the feelings behind it.
I think you said something really interesting about what it says about the societies that we live in, the fact that there's a need. There's a lot of shame, of course, and there's a need to use something to help get those inhibitions go down. Perhaps historically it's always been the case. I'm interested in knowing what sex work taught you about the society that we live in.
Oh my God,
So many things, I'm sure.
so
But
many
if
things, yeah,
there's
so many
one or two,
things.
I've interviewed several people who have engaged in sex work throughout their lives, and it's always been very fascinating to hear what that has taught them, what those periods of their lives have taught them about this world that we don't get to see on a day-to-day basis.
When I think about sex work as an occupation, honestly, I think that it's such a sacred and such a beautiful occupation, because most of the time what we're actually doing is to provide a type of intimacy and interaction that people crave so badly, so badly, and that because of the gender norms, quite often that type of intimacy is just never met. So one thing that sex work has taught me is how incredibly lonely men are, mostly men, and how incredibly exhausted women and gender diverse people are because of the same systems. In my opinion, that's the biggest, like, that's what I have learned. Like, that's the most beautiful thing that I have learned because of sex work. I also learned that the price that sex workers have to pay for the shame and the loneliness and the lack of capacity to connect from cisgender heterosexual men mostly, that burden and that price, we have to pay it, right? Because it is us, the ones that are being persecuted by the system, the ones that are getting murdered, the ones that are being ostracized. And it's just so incredibly unfair, because what we're doing, it's actually probably one of the kindest form of occupation that exists.
Something that a sex worker that I've interviewed, her name was Luana Muniz. She was a Brazilian trans woman. When I interviewed her back in Rio de Janeiro, what seems like a lifetime ago, I think one of the beautiful things is how my interactions with sex workers have often exposed my own biases when it comes to sex work. And something that she pointed out is that she did not sell her body, which is often what we talk about sex workers selling your own body. She said, no, I don't sell my body. My body is mine. It's not for sale. I sell a service, which is a very, it's such a crucial difference. But in mainstream narrative, we talk about sex workers as selling bodies, which is not the case.
We need to get out of our heads that if we are hiring someone to come and clean our house, then they are our little servants. They're not. They're literally helping you. So
yeah, they're providing a service. Precisely.
Yeah.
And we pay them by the hour, just as we would do with a sex worker, or just as I get paid by the hour to do what I do in my day-to-day job.
Any consultant gets paid. Like, I mean, in fact, I genuinely think that sex workers should get paid a lot more, because the role that we play in society, it's just way much more important than any banker, than any insurance company, like, for real.
I can already see this as a beautiful soundbite to come out of this interview. Moving on to another aspect of your work, and that's the HIV activism. You have spoken openly about living with HIV. In the current political climate, where so many conversations around body, sexuality, and identity are becoming polarized again, especially in the past year and a half, 2 years, what does it mean to live publicly with HIV today?
Oh, it means that I have to deal with a lot less, can I say bad words here?
Of course, you can say whatever you want. There's
with
no
unloudless
censorship.
assholes. Like the great thing about being publicly living with HIV is that when it comes to dating, I don't have to deal with people that lack information or that are full of prejudices. At the bare minimum, is people that are willing to learn. I am in a really privileged position in this, in like when we're talking about that, because I had a degree before I was infected with HIV, a degree in microbiology. Like I knew when I was sexually abused and when I was infected with HIV, at that moment I knew that although my life was going to change, it was not going to end. And I had tools to deal with it and to navigate with it. I was 22 years old, but I was already a microbiologist. That is a huge privilege. Now, having to navigate the healthcare systems and have like getting antiretroviral treatment when you are a migrant in Europe. And again, yes, I might be a migrant in Europe, but I am a documented migrant who arrived here because of university, because I got a scholarship. I'm not a refugee, I'm not an asylum seeker, very different circumstances, right? And then on the other hand, I genuinely think that I have a very different sense of shame than most people. I don't see any reasons to feel ashamed about being HIV positive because rationally speaking, there's none. So I don't really feel ashamed. And if people have an issue with that, I also like from a legal perspective and from a moral perspective, the fact that I am undetectable and knowing that I am undetectable means to me it's just so clear if I'm going to have a hookup, I don't have the need, no moral or legal, to disclose that. And so, because it's just basically like disclosing whether I have asthma or diabetes, I'm not going to share you that. That's none of your business. It's none of your problem. People have the tendency to disagree with that statement. And I just don't care because the law doesn't disagree with me. And because morally speaking, I'm not putting you in any danger. So my recommendation when that type of things happen is just Google U equals U, but I'm not going to be your teacher unless you want to pay me.
Talking of science and knowledge, medicine and colonialism, public health and science are often presented as neutral, objective spaces. Where do you still see colonialism, though, creeping into medicine or research or global health in general?
So, like, first of all, pretty much every single standard of health, of beauty, of body shapes, and what all of those standards have been based and created around whiteness, 100%. So because they have been created around whiteness, that's the standard. And when it doesn't follow the standard, then automatically it's wrong. And the way that you can see very clearly that is how, for example, trans feminine and trans masculine people today have to reach the hormonal levels of cisgender white people, their white cisgender counterparts. And why? Well, the answer is quite simple. You cannot talk about gender without an explicit mention of colonialism and especially anti-Blackness. This is not me saying it. This is a quote from Sir Riley Norton, an amazing, amazing author and doctor in philosophy from the United States, a brilliant trans man. And like the thing is that precisely because whiteness required this binary system to function, men and women in the kitchen, men in the mines, and they could not allow something in between or something extracted from it to exist. They removed all transness from it, and then they made sure that the white biology would be the only one that would be accepted. And so today, as a trans brown woman, as a woman with an indigenous heritage, whenever I am going to the doctor is reviewing whether my estrogen levels are as high as cisgender white women and my testosterone levels as low. And the thing is that unfortunately that's not how bodies work. Bodies have different amounts of testosterone, estrogen, and other sexual or non-sexual hormones, regardless of whether they are assigned male at birth or assigned female at birth. And that's just part of the concept of biological sex. Biological sex is not binary. There's a plethora of variables that define biological sex between hormonal content, chromosomal content, epigenetics, you name it, genitals. And so, like, we cannot think that these binary standards that have been thought from a place of whiteness could possibly apply to all of us. The result is that many trans people quite often get sick because they're, like, for example, trans feminine people reducing their levels of testosterone to ridiculously low levels, it's unhealthy. And so, like, one of the most beautiful ways for trans people to decolonize trans specific healthcare is when we come together and we talk about these things. And then we're like, you know what? I'm just not going to take that testosterone blocker that my doctor is recommending. And we have to do this quite often because medicine and not just medicine, but many, many systems do not actually integrate the trans experience into their realities. And the same applies to science, and the same applies to public health. The way that we understand intersectionality, the way that we have key populations, we have these 5 groups, right? Men that have sex with men, transgender people, people who do sex work, people who use drugs, and people in prison settings. We are all the same. We're all part of the same communities, but we keep segregating each other because the people who came up with these distinctions, well, on one hand, we needed to have the labels to push for policies, but it's just not how it works. It's not how it works. Go to a ball, from the ballroom scene, go to a ball, and what you find, it's different knots of consciousness where intersections come in different ways and in different layers, and each of those intersections shape their lived realities, and those lived realities coming together in one space. That is how things actually function. That's the reason why you cannot detach one thing from the other. And then just to closing here, yes, that colonial heritage is it continues being present everywhere. I mean, let's just look at, for example, the way that drug use is addressed. Alcohol and cigarettes are completely illegal, regardless of the fact that nicotine and alcohol are so incredibly harmful and addictive to the body. But things like weed are illegal in so many different places. Things like mushrooms, it just makes no sense. It honestly doesn't make any sense.
What could help make some sense, or at least change the laws around what's legal and what's not legal, are institutions. So you work with institutions like the WHO and UNAIDS, while also remaining connected to grassroots realities. Do you still believe that institutions are capable of any transformation, or are they too often constrained by the systems that they operate within? I will give you a moment of lived experience. I was in Geneva recently for the World Health Assembly. I was inside the United Nations building, and I lived this dystopian dichotomy of finding myself inside one of these institutions whose very purpose was to maintain a sense of international legality when it comes to the ways in which states and nations interact with one another. And then, of course, as soon as I turned to my phone, I saw images of genocides and wars and total impunity. How do you reconcile the grassroots work and the institutional work that you do?
So, first of all, 2 things can be true at the same time. And first of all, I do think that the institutions are incredibly limited, incredibly limited. Yes. But then on the other hand, I do believe that there is possibility for institutions to influence change and to produce and facilitate change. The thing is, we need to have clarity of what the institutions are for, how to approach them, how to engage with them, and how to profit or benefit from them. UNAIDS is a UN joint program. It's not even an agency. UNAIDS is a joint program between member states, UN agencies like the WHO, UN Women, UNODC, and civil society that came together to come up with a way to tackle the HIV pandemic through a global HIV strategy, right? And then just provide technical guidance and programmatic support to the different countries of the world on how to address HIV. But UNAIDS does not legislate, and we cannot tell the countries what to do. We can guide them, and we can encourage them to commit through policy documents such as the political declaration that is then negotiated in the high-level meetings of the UN in the General Assembly, which happens every 5 years. So having an understanding of what are the different institutions' roles and how we can leverage from them, it's incredibly important. Because at the end of the day, it doesn't matter how many standards of care does the ECDC producing or how many guidelines the WHO releases, if the member states, if the governments do not support or do not develop laws, policies, and practices that are following those guidelines, we're never going to be able to achieve any changes. But then again, who elects those governing our countries? They're elected democratically, most places, which basically means that at the end of the day, it is the communities, the ones that are still holding the power to some degree or other, depending on each of your country, how much you can actually influence change. So it's both as the system is right now, as the system is right now, we need both. We need grassroots movements that are promoting cultural change, that are promoting transformation that is bottom up, but we also need allies in these institutions and policymakers, whether it is UN institutions or whether it is like governments, regional institutions like the EU. We need them. We need to work on both of them. That's the reason why, given the possibility, I just decided to be present in all of them. Why not?
And on that note, one last question for you. You occupy this very unusual position simultaneously as researcher, patient, activist and public voice. What is the emotional cost that carrying all of these identities have at once?
I don't know how to put it. Like, the thing is that at this point, I don't wake up in the morning thinking like, oh yeah, I need to go to work. I wake up at whatever time feels comfortable for me to wake up. And then I never really stop until I feel like it's the right moment to stop. Because working for me at this point doesn't feel like working. This is a calling to me. This is not just a 9 to 5 salary check. No, this is a life. This is a calling. And to me, like, you could perceive this, that there's like this big emotional burden, but it's quite the opposite. I feed from the emotions that are triggered in me and my communities. I feed from the conversations that I have with the grassroots, but I feed with having just like sincere emotional one-on-ones to member states that, after listening to what you have to say from a perspective that is both academic, but is also lived experience, then they actually might consider changing their minds and support a policy that they were not thinking of supporting before. What can I tell you, Bibs? It's just vibes at this point. It doesn't really feel like working. Davide, like, when I say that it doesn't feel like work, I'm not saying that it feels easy. I'm saying that it feels like an absolute need.
It's a calling. Yeah.
I could not think of doing anything else, because I cannot be like sitting here having the privileges that I have and access to all the networks and platforms that I have and do nothing. It's just not possible.
We're recording this on June the 1st. It's Pride Month, beginning of Pride Month. Exactly. Pride, it's an important moment for visibility. And what's one last final message from you when it comes to the trans community for this Pride Month?
You need to clarify your question. You want a message from me to the trans community, or from who please? Yeah.
From you as a representative of the trans community to people like me who are not part of the trans community, though part of the queer community. So I can leave it I can leave the audience as open as you want. And I know that you cannot be a representative of the whole of the trans community, for sure. We're talking in very generalistic terms.
There is something that I believe all trans people in this world do, consciously or subconsciously. And again, as I said before, it's to just be that mirror to a wound, right? A wound left by gender norms. A wound that tell a lot of men that crying was for sissies. A wound that make women and trans feminine people feel terrible about their bodies. For example, a set of rules that said that if you're not married before a certain age, or if you don't have kids, then you're a failure, or that if you're not providing, or that system, it's constantly harming all of us. What trans people can definitely invite you to do is just to actually start embracing a little bit more who you are, to love yourself a little bit more, to respect yourself a little bit more, and to stand up a little bit more for who you are. Because if you go to sleep at night ashamed of the fact that you were attracted to a trans woman, and you hide all of that and you repress all of that until it comes out in the shape of anger and transphobia, you're not just hurting us, you're hurting you. You're a slave. The invitation is to decolonize yourselves and to join us. We have cookies and a lot of lubricant and acid. We have acid too.
And on that note, and I was happy with the cookies and the lubricant, but let's add the acid as well.
Yeah.
On that note.
Yeah.
Thank you very much, Amanita, for your time today. It's been a real pleasure talking to you. I look forward to being in Berlin, hopefully in October at the latest, and hanging out with you there. Thank you
for your time. Sure. Davide, thank you so much, my dear, and looking forward to see the outcome of this beautiful interview. Thanks.
Thank you.